The dentist explains to the patient that the first step in this process is to establish a jaw relational record. This record will capture how much space the denture can be allowed between the dimensions of the patient's maxillary and mandibular jaws. For patients that have worn dentures for extended periods of time, erosion of the jaws can create new challenges for the dentist to adapt the prosthesis for their current jaw vertical condition. Patients that are wearing older dentures can actually feel this erosion effect over time and routinely fill the space created by the erosion with their tongue. The laboratory fabricated bite rims are placed into the patient's mouth. The dentist checks the positioning and stability of the bite rims on the patient. He then requires the patient to verbalize different sounds and observes how the base plates interact with the existing tissue. The dentist looks for obvious facial distortions during normal routine sounds and tongue movement. For this patient, he observes that the lower bite rim is too large and needs to be adjusted. To provide this adjustment, a laboratory hot plate is warmed above a laboratory alcohol torch. The lower base plate is then pressed against the warmed plate and worked to remove excess wax. Afterward, the dentist then uses a laboratory knife to remove and smooth additional areas of the bite rim. The modified bite rim is placed again with the patient's mouth, and the patient again repeats the same, as done before. The dentist evaluates the patient, looking for improved profile and facial aesthetics. Using a laboratory wax carving tool, the dentist marks the midline or central point between the patient's two central incisors. Additionally, the dentist scribes the high smile line. The cervical necks of the teeth will come above this line. The location of the canine cusp tips are marked on the bite rims. These are located on the corner of either side of the mouth. Their location is determined vertically from the lateral edge of the nose on either side. A dental ruler can be used to confirm the distance from the cusp tip to the distal edge so that the correct denture tooth mold can be selected. The final step is to notch the bite rims to hold additional impression material. You can see the dentist uniquely notched the maxillary and mandibular bite rim, with the maxillary having 3 notches carved into the rim and the mandibular having only 2 notches. Additionally, the dentist uses a Fox plane to determine whether the bite rim is parallel or flat to the interpupillary plane. He also reviews the occlusal plane from a side view between the tragus of the ear and the lateral side of the nose. With the bite rims inserted into the patient, the dentist can be seen injecting a small amount of bite registration material. The patient then is instructed to bite naturally, compressing the registration material between the 2 bite rims and into the relational notches. The dentist inspects that the notches in registration material align correctly when the patient opens and closes their mouth again. Lastly, the dentist removes the bite rims from the patient and inspects that the registration is intact and not bitten through by the patient or distorted in any way. This is proof of an accurately captured interocclusal record.